one of the issues that policymakers and clinicians and others are trying to solve is that we have many people who are living with dementia that are undiagnosed or diagnosed late in disease stage. So there are many issues associated with remaining undiagnosed or diagnosed later. So our treatments that we currently have for Alzheimer's disease are for early stage disease. So for people who are obviously undiagnosed, treatments are not an option for them. And people who are diagnosed late in the disease stage, again, treatments may not be an option for them. Earlier diagnoses supports the person with dementia to make their own care decisions, to make some decisions about financial planning. And we have a really robust clinical trial and drug pipeline and interest from the community in getting involved. But again, this often requires an understanding of what your risk is or with whether you have Alzheimer's disease or other types of dementia early on. So why do we have this issue of undiagnosed and late diagnosis? So one of the important factors that makes dementia or Alzheimer's unique to other diseases is that we don't have a population screening program. So we don't have recommendations for annual screenings like we do for, say, mammograms or blood pressure. So there's not every year someone gets screened and they can follow over time. Things are changing to get those early symptomatics that can help you on this pathway to getting an early and accurate diagnosis. But we do have some systems in place that could potentially help and support early and timely diagnosis. And the key program that we have is something called Medicare annual wellness visit. So this is a fully reimbursed preventative care visit that's for all Medicare beneficiaries. So everyone in the Medicare program over age 65 has access to this benefit. And as part of the annual wellness visit, a cognitive cognitive impairment assessment is a requirement. However, we looked at the use of annual wellness visits and cognitive assessments that are occurring at the annual wellness visit. And we find that use of both the service, this free visit, as well as what happens at the visit, is not as robust as we would hope. So we found only about 50 to 75% of persons who are eligible for this benefit, all Medicare beneficiaries, actually have an annual wellness visit each year. And, there are many reasons why people might not access this benefit. Part of it could be just not understanding what the annual wellness visit is. And it's also a very long, intensive visit. So people might be a bit time constrained. We also looked at what happens at the annual wellness visit. So do people get a cognitive assessment, and what kind of cognitive assessment? And again, here we found really low rates of people reporting that they had a cognitive assessment. And part of that is a fairly, I would call, easy policy solution. Right now, the policy doesn't actually advise clinicians on what constitutes a cognitive assessment. So it could be as much as, are you concerned with your memory? There's no requirement for any validated screening type of instrument to be used. So that's something that we could solve pretty easily. But there are other barriers that I think are a little bit harder to solve. One of them is that the cognitive assessment may not be well integrated into sort of the healthcare system, how health is performed in this annual wellness visit, which has a lot of components to it. And the reimbursement for physicians to get through all of those components and find the time in their workflow, it's very constraining. And the reimbursement for the visit itself is not very high. So there's some financial disincentive for healthcare systems as a whole to really promote the annual wellness visit and all of the required components. So another policy lever there is reimbursement. So we know from other studies that the services that are have higher reimbursements tend to be used more. So we have a policy lever around sort of reducing some of these healthcare system factors to getting people screened. Now, once we get people screened, then there's this pathway from screening to diagnosis that has its own set of barriers. But it's an important first step because screening is where you typically can pick up those very early stages of symptoms, or at the very least, begin tracking changes.